As an organization, I believe we are seeing what the nation is seeing, which is an increase in need, an increase in referrals, an increase in visits across our continuum of care, being outpatient psychology and psychiatry services, crisis and emergency services, day treatment and partial hospitalization services, as well as school-based and resilience services that we have integrated within the school programs. What we know is that prior to the pandemic, 1 in 5 children suffered from a mental health or condition or learning disability, but fewer than half of those children were receiving adequate support for that condition. What we now also are learning is that about 30 to 40% increase in symptoms is being identified in children post-pandemic. We have a limit in the number of services that were provided prior to the pandemic, and with access concerns, because some providers have not opened up to in-person visits again, we have a challenge in getting children the services they need. What we've also learned is that many populations may be more at risk for the negative impacts of the pandemic on them. And those may be those children who have pre-existing mental health conditions, those children who have experienced some level of previous trauma in their lives, children who live in poverty or in economic instability, and also those children who may have had increased disruption to their daily routine. We know that children thrive with routine, with structure, and with consistency. And probably many of us would say the same things. But what we're finding is that this disruption has been incredibly difficult on many kids regarding their coping and their overall adjustment.